The history of healthcare companies in the United States is deeply intertwined with the evolution of medicine, health insurance, and corporate development over the past 2 centuries. Early history, 19th century. 1800s. Growth of medical practice in the 19th century. Healthcare in the U.S. was dominated by individual practitioners. Hospitals were few, often charitable institutions run by religious groups or local governments. The first modern hospitals began to emerge, providing organized care for the sick. Pharmaceutical beginnings companies like Eli Lilly, founded in 1876, and Kaiser, founded in 1849, began developing and manufacturing drugs. They marked the early days of the healthcare industry, focusing on innovation in medication. Industrial era, 1900 to 1940s. 1900s. Expansion of hospitals. The early 20th century saw the professionalization of medicine and the growth of hospitals. This period also marked the creation of health insurance programs to cover medical costs. Blue Cross and Blue Shield. In the 1920s and 1930s, Blue Cross and Blue Shield programs were established as nonprofit health insurance plans to cover hospital and medical services. Birth of the FDA. The Food and Drug Administration, FDA, was established in 1906 to regulate food and drugs, ensuring public safety and marking a significant step toward modern healthcare regulations. Post-war boom, 1940s, 1960s. Employer-sponsored insurance during World War II. Wage controls led employers to offer health insurance as a benefit to attract workers. This marked the rise of employer-sponsored health insurance, a defining feature of U.S. healthcare. Medicare and Medicaid. In 1965, the U.S. government established Medicare and Medicaid under President Lyndon B. Johnson, providing insurance for seniors and low-income individuals. These programs catalyzed growth in healthcare organizations. Expansion of pharmaceuticals companies like Merck, Johnson & Johnson, and others expanded significantly during this time, producing vaccines, antibiotics, and other breakthrough drugs. Rise of corporate healthcare, 1970s, 1990s. Act of 1973 Health Maintenance Organizations, HMOs, who, after federal legislation, encouraged their development. HMOs became a dominant form of managed care in the U.S. For-profit healthcare companies like Hospital Corporation of America, HCA, pioneered the for-profit hospital model, consolidating healthcare services under corporate umbrellas. Biotechnology revolution. The 1980s and 1990s saw rapid advances in biotechnology. Companies like Genentech, founded in 1976, introduced genetic engineering in drug development. Modern era, 2000s to present. Affordable Care Act, ACA. In 2010, the ACA, Obamacare, transformed the healthcare landscape by mandating insurance coverage, expanding Medicaid, and creating online marketplaces for insurance. Digital health and technology, telemedicine, and health tech companies like Teladoc Health and Epic Systems gained prominence. Companies increasingly focused on electronic medical records and AI-driven healthcare solutions. Consolidation and big players today. The healthcare industry is dominated by large corporations, including pharmaceutical companies. Pfizer, Moderna, and others lead in drug innovation, including vaccines. Insurance companies. United Health Group, Anthem, and others dominate health insurance. Hospital systems. HCA Healthcare, Ascension, and others operate nationwide. Key trends in the U.S. healthcare industry. Privatization versus public policy. The U.S. system uniquely blends private companies and government programs like Medicare, reflecting tensions between market-driven innovation and access to care. Rising costs and access issues. Healthcare costs have increased dramatically, sparking debates about reform, including single-payer systems like Medicare for All. I would like to know your thoughts on today's healthcare system in the United States. Please comment below. Thank you for watching. Please consider subscribing and hit the like button.